Good morning, students. Today's topic is cellular adaptations. So basically this is dealing with how the body, how the cells of the body are combating against any kind of suppose any injury is taking place. That can be physical, that can be chemical, that can be radiological, toxic agents. So due to any kind of injury the cell is taking in, how the cells are adapting itself. So that is basically what I am going to teach you. Okay. So now what are these cellular adaptations? How will you say what are these particular changes? These particular changes are these particularly reversible changes. Okay. Till it reaches an irreversible form, these are reversible changes. Okay. And these can take place in size, you can say the number of cells, you can say that their phenotypic nature itself is going to change, or their metabolic activities are going to change, okay, based on how the cells are reacting towards the environment, any kind of stress, any kind of injury towards the cells or the body, how the body is adapting itself. That is what the cellular adaptations are about. Okay. Now these cells particularly are constantly adapting, as I am sure you all also know that you all are always now in this lockdown condition. You all have adapted yourself to staying at home itself, and you all are working, you all are studying. So these, and now like your body has adjusted itself and adapted itself, cells also keep on adapting itself. Okay. Now they can be physiological as well as pathological. Okay. Physiological meaning that due to certain number of hormones which are stimulating some kind of change in the body or the cells. Okay. For example, in a case of pregnancy, the demands of the body itself increases. Okay. So maybe there is always you will find that there is an enlargement of the breast, particularly for the baby has to lactate. I mean the baby has to take in the milk. The milk secretion and all is there. So that is also showing that how the body is adapting itself because of the increased demand of the body and certain amount of requirements of the baby. The body is changing itself by increasing in size. Okay. This is one of the important examples of cellular adaptations. Okay. Now physiological adaptations usually represent certain response of these cells to normal stimulation by hormones or endogenous chemical mediators. Okay. Like I told you one of the examples. Okay. Second is the demands of mechanical stress. Okay. In case of bone and muscle particularly, this is an example. Okay. And pathological adaptations are response of the stress that they are getting, the cells. They are modulating their structure as well as the function, and thus they are escaping the injury or adapting itself somehow. Okay. Okay. This I have already explained to you. So pathological adaptations, they share the same mechanisms as cellular adaptations. Okay. They provide the cells with the ability to survive in the environment, okay, and escape the injury. Somehow their body has been reprimanded in that way, in that condition, that you can see that the adaptations are already there. Okay. And the cellular adaptations particularly state that it lies an intermediate between the normal, unstressed, injured as well as overstressed cells. Okay. So these are what they are doing. These physiological as well as pathological adaptations can take different various forms. Okay. So I will be taking you through these forms particularly. Okay. So there are particularly 5 types. Number 1, hyperplasia. Number 2, hypertrophy. Number 3, atrophy. Number 4, metaplasia. Number 5, dysplasia. Okay. So these are the 5 modifications of the cells or adaptations that the cells undergo when they are placed in a stressed condition, to be particular. Okay. So now you can see this picture. Looking into the picture, if you all were present, I would have asked you all that what is hypertrophy, what is hyperplasia, what is atrophy, what is metaplasia, what is dysplasia. Okay. But unfortunately you all are not there. So I'll explain to you. Looking into the shape, structures and all, how will you say what is hypertrophy? Hypertrophy, immediately you can see that this is a normal bronchial epithelial cell. There has been a sudden increase in the size. So the size has been increased. Okay, that is hypertrophy. What is hyperplasia? The number. The number has been increased. So that is hyperplasia. What is atrophy? Atrophy is, you are seeing that this is the normal size. The size also has been reduced. This is the fuse, you can say, has been reduced. One of the causes of atrophy. Okay. So this is about these three. Okay. First class will be based on these three. Okay. And then comes metaplasia. What is metaplasia? Is it looking something like the normal bronchial epithelial cell? These three are almost looking the same. Only the size or the shape has been changed. Okay. Or the number, not the shape. The size or the number has been changed. But in metaplasia, what are you finding? That this is an absolutely different cell altogether. So that is what I am meaning to say, that the phenotype of the cell changes. Okay. From, say, you are changing the epithelium from columnar epithelium to squamous epithelium. So this is the meaning of changing of the phenotype. Okay. And then finally dysplasia. Does this cell at all look like the normal bronchial epithelial cell? No. Why? Because you can see that the nucleus has been dramatically, you can see that it has been increased. Okay. Associated with that, you are finding that it is not at all looking like the cell of the normal bronchial epithelial cell. So dysplasia is something which has been said that it is one of the precancerous condition. Okay. So I will be coming back to you a little later in the next lecture. Okay. Okay. So now let us start with hyperplasia. Okay. So now what is hyperplasia? Hyperplasia is particularly an increase in the number of cells in an organ. Okay. That stems from increased cellular proliferation, either of the differentiated cells or in some cases less differentiated cells or progenitor cells. Okay. But they resemble absolutely the parenchymal cells, means the cells of origin. They absolutely mimic that. There is no change in the cell size or the shape. It is just the, not the size, the shape or the type of the cells are not changed. Okay. Just the size has increased and the size has increased. Okay. As well as the number of cells. Sorry. So here you can see that hyperplasia is showing an increase in the number of cells. Okay. So due to that, what is going to happen? The cells will be having a particular area, maybe a particular cell has a particular volume. So if you see that the number of cells are increasing, you will find that the size is also increased of the organ particularly. Like that you can see in this particular diagram, this is a uterus. Okay, this is an uterus. Okay. Does this look like a normal uterus? Yes or no? No. Why? Because what we find is the normal endometrial thickness that you see here is not the same. This has been increased due to glandular endometrial hyperplasia. Due to certain hormonal stimulation, the endometrium has been continuously increasing in its thickness. Okay. The endometrial thickness is usually 0.1 to 0.4, you can say, not more than that. Okay. So if that is increased, this is not something which is normal. So this is glandular endometrial hyperplasia. This is a pathological one. Okay. Okay. So now let me come to the types of hyperplasia. One is physiological, okay, and one is pathological. Okay. Now physiological means what? That it is a normal process. Okay. Means the cell's cellular proliferation has been stimulated by some growth factors or due to some hormonal stimulation. Okay. Most common example is a pregnant uterus, a gravid uterus. It will increase 5 to 6 times the normal size. Okay. The normal size of uterus, what will it be? It will normally be 4 into 8 into 12 centimeters. Okay. But if it is increases 5 to 6 times, you can see, I will be showing you a diagram where you can understand. See here. This is a normal uterus size and see the gravid uterus, how big it has become. So this is how you will compare how the cells are being adapting itself. Okay. Second is hyperplasia of the female breast epithelium. That I have already explained. Due to the requirement or the demand of the body, the cells have been increased in the size, okay, as well as the number. Now always remember that hyperplasia as well as hypertrophy are two things which almost happens simultaneously. Okay. They occur usually due to certain same almost mechanism of action and they are happening almost together. Okay. They are in hand, you can say. Okay. So the two types of physiological hyperplasia are, one is hormonal, okay, and two is compensatory. Compensatory means what? Compensatory hyperplasia is when, suppose in some certain residual tissue is growing after removal or loss of part of an organ or a contralateral pair of organ. Maybe see, one kidney has been damaged or whatever and it has been removed. So one kidney is functioning, one is not there. So that kidney which is remaining, that has to function more. It has to compensate for the loss of the one kidney. So that is why what is happening, number of cells are increasing. Okay. Hope you have understood. Number two is, okay, hormonal I will explain. The normal endometrium during a normal menstrual cycle is the most common example. Due to certain hormonal changes, the endometrium will show certain changes. Okay. Like what will happen? In the luteal phase, due to the luteinizing hormonal effect, what will happen? It will start slowly to decrease. Okay, it will start. Suppose if there is no ovulation taking place, it will start shedding. Okay, then during ovulation time, what will happen? It will try to increase, preparing the uterus. Suppose if there is any pregnancy. So like that, due to certain hormonal influence, what is happening? The normal endometrium is acting accordingly. Okay. Okay. Then number 3 is also prostatic hyperplasia. Okay. Due to particularly, you can say that an old age, what is happening? That the seminal, what is particularly happening? The prostate has increased in size, and due to that what is happening, continuously the patient has to go for micturition, and this is the body's adaptation, okay, due to old age, due to cellular aging particularly. Okay. Now one I told you about following nephrectomy. Okay. One is also regeneration of the liver following partial hepatectomy. Maybe one particular area of the liver was having certain liver abscess or something, due to which it had to be removed partly. So the part which is remaining, that has to increase in the size and number so that it can compensate. Okay. The same goes for regeneration of the epidermis after a skin abrasion. Suppose you have got a cut. You have seen that it takes 4 to 5 days, by which again it comes back to normal. So this is what is happening. These are all physiological processes. Okay. So this I have already explained. Okay. Here that you find in the microscopy, this is the normal endometrium. Okay. These are the normal endometrium. You will find these spindle shaped smooth muscles. Okay. All over you can see. And here you find in number C picture, you find that these cells have been increased in the size. This is in high power. Okay. This is in low power. Okay. So then I come to now the pathological causes. Okay. Now most forms of pathological hyperplasia are caused due to some again excessive hormonal or growth factor stimulation. Okay. This is the main thing, that in hyperplasia of the endometrium there is some disorder of the some kind of hormonal imbalance, due to which there is hyperplasia of the endometrium. Okay. So the pathology remains same in case of physiological as well as pathological. Okay. Number 2 is wound healing. In wound healing, what do you find? Immediately, it can be first degree or second degree, what you will find. Immediately at the site of injury, the cells try to come and it tries to proliferate. So that what happens? The healing takes place slowly. Okay. So proliferation of fibroblasts as well as endothelial cells are seen. This I think for the new students, for you all particularly, you all will be taught, I think, little later on. And then number 3 is skin warts from hyperplasia of the epidermis due to a particular virus, that is human papilloma virus. Okay. Here what happens? The epidermal layer, that is due to in that particular layer there is hyperplasia. Okay. And then what will happen? A skin wart will appear. Okay. But one of the reasons is human papilloma virus. Okay. Not all, but certain causes are, one of them is human papilloma virus. And number 4 is pseudocarcinomatous hyperplasia of the skin, where the doctor sometimes feels that maybe this is a case of carcinoma, but actually it is not so. Okay. So this is pseudocarcinomatous hyperplasia of the skin. Okay. Okay, an important point in all these situations is that the hyperplastic process remains controlled. Okay. Always remember that. If the signals that initiate it abate, the hyperplasia will disappear. So this is a reversible process, not an irreversible process. Okay. And this is in response to a normal regulatory control mechanism. Okay. That distinguishes the pathological hyperplasias from cancer. Always remember this. Suppose if this happens, that the hyperplasia is carrying on and it is unable to stop, then that is not hyperplasia. That has gone to the stage of cancer. Okay. So what happens? The growth control mechanism is present. Okay. So that becomes, you can say that it is a reversible process. If that growth control mechanism becomes permanently, say, dysregulated or ineffective, okay, what will happen? It will become something different. It will become a state of cancer. So endometrial hyperplasia is a condition which is people are a little afraid of, because certainly due to certain hormonal imbalances, the endometrial hyperplasia has taken place. But what happens if the process becomes uncontrolled? What will happen? It will lead to endometrial carcinoma. Okay. So this is about hyperplasia. Okay. Then I am coming to hypertrophy. Okay. What is hypertrophy now? Hypertrophy is an increase in the size of the cells. Okay. With a sudden change. Okay. An increase in the size of the organ. Okay. So this is the picture. Here you can see this is a case of hyperplasia as well as hypertrophy. Both things have taken place. Okay, that is the funny thing. Hypertrophy as well as hyperplasia both occurs almost together in many cases. Okay, so the types include physiological as well as pathological. In physiological, the uterus, the physiological growth of uterus, you will find that the size slowly increases when it becomes to puberty. Okay. Then in pregnancy, what will happen? Both hyperplasia as well as hypertrophy will take place. Okay. Now what happens in hyperplasia? We have seen that there is an increase in the size of the cells. Okay. But in pure hypertrophy, what will happen? There are new cells. Always remember that the cells are not new. So the cell proliferation does not take place. It is just that the old cells itself has increased in size. Okay. So now hypertrophy can be both physiological as well as pathological. Okay. Either caused by increased functional demand as explained earlier, or by some growth factor or hormonal stimulation. Okay. So the massive physiological enlargement of the uterus during pregnancy occurs as a consequence of estrogen stimulated smooth muscle hypertrophy as well as smooth muscle hyperplasia. So both hypertrophy as well as hyperplasia has taken place. Okay. In contrast, what happens in response to some increased workload, striated muscle cells in both the skeletal muscle as well as the heart undergo hypertrophy, because the cells, what happens, they undergo certain kind of, you can say, cellularizations. Okay, means if they are trying to adapt itself. Okay, due to because they have a limited capacity to divide, especially the cardiac cells. So what will happen? The heart cells, they will be undergoing only hypertrophy but not hyperplasia. Okay, remember this, that cardiac hypertrophy is something which is very common. Okay, but what is happening? It will occur due to some weight lifter. If they keep on starting to lift heavy things, what is happening? Their biceps and the triceps, they will keep increase in the size. Why? Due to hypertrophy as well as hyperplasia. But in cardiac muscles, what will we see? That the cell division is limited. Okay, so we will be unable to actually know whether hyperplasia is taking place. So that is solely hypertrophy. Okay. Okay. Now in pathologic causes, what will happen? There will be again increased workload, hormonal stimulation, growth factor stimulation, and hypertrophy of heart is the most common. I have already explained to you. So here in the diagram you can see of an example of pathologic hypertrophy, cardiac enlargement. See, you can see. This happens particularly when there is hypertension, okay, or aortic valve disease. The differences normally are adapted, okay, and these are irreversible, okay, because these injured cells will be irreversible, okay, because the response of the heart are little different to the different types, okay, of adaptation, of stress, okay. Now the myocardium here has been subjected to persistently increased workload, okay, due to hypertension, one of the causes, or say maybe some narrowed valve due to stenosis or something. Okay, so what is happening? The hypertrophy has taken place. See the thickness, if you compare, it is so much compared to this. You can see the difference. See here, this is a normal myocyte, this is a normal heart, but see here how much it has been increased. Okay, this is the main thing. Okay, what is happening? The cellular adaptation depicted here is particularly hypertrophy, and the cause is reversible injury, leading to irreversible injury if there is some ischemic necrosis. Okay, coagulative necrosis particularly. So this is about how the cardiac is the cardiac muscles are adapting itself. Okay, a very important cause for hypertrophy. Okay, so you should be knowing that you can distinguish between pure hypertrophy as well as both hypertrophy as well as hyperplasia. So here I have explained, earlier also I have explained, hypertrophy as well as hyperplasia, they are two distinct processes which frequently occur together and they are triggered by the same mechanism. Okay, so I am sure you have understood that. Okay, hyperplasia as well as hypertrophy. Okay, okay. Now I come to atrophy. Okay, now looking into the picture of atrophy, I am sure you have understood what is atrophy. Atrophy is a shrinkage in the size of the cells by the loss of the cell substance. Okay, why is that the loss of the cell size? Maybe due to reduction in the size or the number of parenchymal cells. Here you can see in this left picture the cells are normal. Okay, the cell size is normal, the number is normal, but in here in this picture you find that the cell size has been decreased. Okay, and the number has also reduced. Okay, so when there is a sufficient number of cells involved, the entire tissue or organ is reduced in the size. Okay, so although atrophic cells may have diminished function, they are not declared dead. Cell death has not taken place. Only the size of the cells has been decreased. Okay. Now there are physiological as well as pathological causes. Physiological causes, main thing is normal process of aging. When the body has aged, when the function has been already done, the function of the cells, the organs is complete or about to be complete, what will happen? There is a loss of proper endocrine stimulation, means hormonal balance has been lost. There has been an imbalance or the stimulation which was present. See in females at menopause, will the hormones supply the same amount of hormones? No. So this is the main thing. Due to cellular aging, the normal aging, what is happening? There is a loss of the endocrine stimulation, or maybe due to certain blockage in the blood supply. What is happening? There is arteriosclerosis, one of the causes. Okay, so examples are atrophy of the lymphoid tissue in lymph nodes, appendix. This is a picture of the brain. Here you see that the size of the brain has been reduced. Okay, the normal sulci gyri does not look like this. I am sure you have understood that. So this is atrophy of brain with aging. This is the diagram showing the picture. Okay, and mainly now causes are pathological causes includes starvation atrophy. In starvation, what is happening? First there is depletion of carbohydrate, followed by fat, and finally protein catabolism. So what is happening? We have not been given food. If you are not giving food, from where will you get the energy? What will happen? First the body will try to use carbohydrate, followed by fat, and finally protein, ultimately leading to disuse of the organs and finally atrophy. Okay. Then number 2 is ischemic atrophy. When there is certain kind of blockage in the blood supply, the blood supply is unable to reach, or there is less amount of blood supply. Okay, due to that what will happen? Hypoxia will occur, and due to that what will happen? Some kind of reaction will happen, ultimately leading to atherosclerosis. Okay, and then number 3, disuse atrophy, one of the most common. When there is a decreased workload itself, when the demand itself of the body is not there. Okay, for that we will find that there is atrophy of that particular organ or cells. Okay, here we find that there is atrophy of the pancreas in obstruction of the pancreatic duct particularly. Okay, and then also another example is immobilization of the limb due to maybe fracture healing. you have immobilized a limb. What will happen? For a long time, if you keep that limb immobilized, the cells will slowly start getting atrophied due to no function or decreased function. Okay. Then is neuropathic atrophy. Example is poliomyelitis. Due to some nerve, due to some neural stimulation not reaching that particular area, that area becomes atrophied. Okay. So, some of these stimuli are physiological, some stimuli are pathological. Okay. So, they represent a retreat by the cell to a smaller size. Okay. At which the survival is still possible. Okay. So, a new equilibrium is achieved between the cell size as well as diminished blood supply. Okay. Or the nutrition or some tropic stimulation. Okay. So, the cellular atrophy results from a combination of both decreased protein synthesis as well as increased protein degradation. Okay. Now, what we see that in pathological atrophy, there is causes of endocrine atrophy also. Means what is happening? Due to reduced amount of hormone secretion, it may lead to atrophy of, pituitary gland is a gland which is still controlling lot of other glands. So, if there is some kind of defect or some abnormality in the pituitary gland, that the gland itself is unable to stimulate its organs, its enzymes, what will happen? Those enzymes will be unable to stimulate the other glands like thyroid, adrenal, gonads. So, finally what will happen? There will be atrophy, disuse, misuse. Okay. This is the main thing. Okay. And this is happening why you have understood. One is due to decreased protein synthesis or increased protein degradation. Okay. Increased protein degradation or decreased protein synthesis. Okay. So, these are the two main causes. Okay. So, what is happening? The degradation of the cellular proteins are also taking place. Okay. So, this is how atrophy is taking place. Okay. Hope I have been able to make you all understand the three processes: hyperplasia, hypertrophy as well as atrophy. Okay. I will continue with metaplasia as well as dysplasia in the next class. Okay. Thank you, students.